Hello, my name is Takyiwa-Mensah, and today I'm very happy to introduce you to HealthMate. HealthMate is a digital platform for managing hospital operations, designed specifically for hospitals in Ghana. With HealthMate, it is our aim to provide a solution you can trust, allowing you to peacefully focus on the most important things, your busy duties, while our system ensures that data is accurately captured, stored, shared, and reported to enhance your organization's productivity. In this demo, I will show you an example workflow that includes records, cashier, triaging, consultation, lab, pharmacy, and account profiles. Let's note that although these roles are designed to be independent, we can easily combine any of these roles to meet or to adjust the role or profile to what's happening in your facility. Without much ado, I will log in with the records profile to begin the workflow. So on this page is a login form, a simple login form that requires the user's username, in this case records, and password. After inputting the fields, you click on sign in and you have this dashboard. On this dashboard, we can find the header here, the name of the software is here, the hospital's name is here, the branch is here, and then the user's username is also here. This button logout is used to obviously log out. Now on the main page, we have the navigation, which you can use to move easily to different pages in the profile. On the main page, we have the records dashboard, the dashboard title today, and then the branch name, and these buttons for easy access to other forms. And then also I would like to talk about this find patient search box you see here. Now this search box is used to find patient, assuming there is a patient already in the system. You have a patient already in the system coming to the hospital again. Then in that case, you can easily type some part of the name and click on find patient, and all patients having that part, that text in their name will appear here. As we can see, Danny and then Daniel Boahen appears here. Now I would also like to demonstrate how to add a new patient. With that, you click on add patient and the add patient form opens for you here. Then we go through the form filling. Then with the date of birth and age, we know that there are some people who come to the facility without knowing their date of birth, but they know their age, obviously. Now in that case, to allow for such situations, the system provides this age button, which when you enter the age like 30, the system automatically populates the date of birth field using July 1st July as the date of birth, and then it calculates the age for you also. We'll go on with the other part of the form. And then we input these fields. These are some data I'm just putting in here, right? So on this form, the fields with the red asterisks are the required fields. All the other ones without the asterisks are optional. You can choose to input them or not, right? So you save the patient. After saving the patient, we have this patient detail form that shows the information of the patient that we have just inputted. Now, from after adding the patient, what we can do next is to add coverage. Adding coverage is like adding insurance insurance accounts of the patient, or so to say sponsors of the patient, right? So to do that, you use this button, add coverage. When you click on it, the coverage form opens for you where you can select provider. In this case, we are picking NHIS. We are using the Ghana card as the member ID, and then the scheme name of this particular insurance. Let's say standard, validity and valid to. Valid from and valid to are optional. I'll leave them. And then the flags. I would like to talk about the active flag. The active flag is used to indicate the activeness of the coverage, right? So if we deactivate this, it means that when we are creating an encounter for this patient, this particular coverage or sponsor or insurance cannot be used to create the encounter because it is deactivated. Now you can toggle between active and inactive, and then to set the active state of this particular coverage. The primary flag is to indicate what is the main payer of the patient in cases where they have multiple insurance. So as we go forward, we will see exactly like what this means here. So after filling the coverage form, very simple, you click on save coverage, and then the coverage is saved here. So we are back on the patient details page, and we see that the coverage is also showing here, NHIS and the member ID and the scheme. This is what I'm talking about. We indicated that this is the primary coverage, and it's also active. With this, there is this easy links here that you can use to deactivate it. Now it's inactive, and activate it as well, right? And then we can set as primary also here, right? So that is just about setting up sponsors or coverages for the patient. After doing this, now we can create an encounter. There are two, yes. So to do that, you use this new encounter button on the patient's page, right? When you click on new encounter, the encounter form opens. The patient name is already selected because we are coming from that patient's page, right? So the patient name is already selected here. We can change it here by searching another patient. Let's say Daniel, and then search Daniel Boahem, pick yes, but we want to use the patient that we already created. So Oswald, and there is search, and Oswald Ajamanodro comes. Then we branch. The branch, we are leaving it to main branch. We are picking department. So the data in here will be populated with your hospital's data, certainly. Right, and then the payer, we have two kinds of payer. We have the self, which is if the patient is paying by themselves, like they are paying cash for the encounter, or insurance. Now, in this flow, I will go with the cash payer for now, and then later we will demonstrate how the insurance works as well. So to pick the cash, you just click on it, cash, and then an estimate of the encounter fee is provided here. Now after that, we can go ahead and click on create encounter, which creates the encounter for you here. Now after that, we have this encounter detail page, which shows information about the encounter, next step, and then files also here, right? So in this case, if the patient has some files that the records person needs to upload, you can use this browse file, find a file, and then you upload it. Now the file is uploaded. Now after doing such thing, if there is the need for, then there is also the next thing to do is this issue queue ticket here. This issue queue ticket is to help the hospital manage the sometimes busy and long and chaotic queues that happens in the OPD center and going into consultation room. Now here, the records person can issue a queue ticket to the patient, right? So you just click on issue queue ticket. The ticket has been issued, but then the system is telling us that payment required, ticket number 1. Now what this means is that because we had a cash encounter and then there is a fee on the encounter of 20 cedis. The patient is supposed to pay that amount before they can join the queue actually, right? So to show how payment is made, I'll log out and log in with the cashier profile, and then we see how it continues from there. Right, on the cashier's page too, this is the interface that they have. Obviously the navigation is here, the header page is the header bar is here, and then the main page. So the cashier uses what we call shifts, like the periods they are working basically. So there is a shift already open. I created it before. And then what I want to highlight is this is the record we created from the encounter page. We have Oswaldo Drageman, cash due is 20 cedis. We remember that the cash for the encounter, the fee for the encounter was 20 cedis. So the cashier can just click on this receive button and then indicate what method of receiving the cash, whether it's Momo, POS, bank, or cash. I'll pick Momo here. If there are any reference, this is an optional field. You can choose not to fill it, and you can record the payment here. Now the system knows that the fee for the encounter has been paid, so we can go back to the records page to see what's happening there. Now in the records page, when we come to the queue and we click on waiting, we see that ticket number 1 waiting is the ticket number 1 is now in waiting status, and Oswaldo Drageman, right? So then at this point, we take it that the patient is now waiting to be triaged, right? Or moving to the OPD nurse station. Then I'll then log out and log in with the OPD nurse account and see how the workflow continues from there. To do that, I input the username and then the password and then click on continue, right? So at this point here, this is the nurse's OPD nurse dashboard, right? The navigation shows a little bit many. There are many links here than compared to the records page. And it depends on what functionalities are available for this user or for this profile. Right, so on the dashboard here we see the branch and department, which you can change per your need. And then also now triaging. The now triaging is like the current patient that the user is attending to. And then also next patient. So this is what the ticket thing is actually about. The next patient, the system already by the ticketing feature, the system knows who is next like that. So now if the user clicks on start triage here, the system automatically knows the patient who is next. So it opens this page, which we call the encounter workspace. So this is for patient. On the encounter workspace, things to pay attention to is the patient's name right here, to ensure that you are working for the right patient who is before you. Now, in the encounter workspace too, there is this to-do card which highlights or indicates what has been done for the patient in this encounter. So from here you see that vitals action needed means that no vitals has been inputted, clinical notes, nothing has been done, medication and stuff like that. Also, the page has been separated into panels. Now the overview panel gives you an overview of what has been done for the patient in this encounter. Vitals also shows vitals information, note shows note information, diagnosis, orders, admission, consumables, medication, billing, history, right? So with the OPD nurse, what they usually do is to input vitals. To do that, yes, you come to the vitals panel here. On the vitals panel, we've organized the page into three sections. We have the latest vitals, which shows the latest vitals that has been inputted in this encounter. And then the middle section is the form for recording vitals, so you don't have to move between pages. No, the form is right here, and then the bottom section is the vitals information, right? So to record vitals, you just fill the vitals form. I'm going to input some dummy data. Forgive me, I'm not a doctor, so maybe some of these data will not make sense. Yeah, I want to kill the person. Pause. 88 SPO2 96. Alright, and then I save. Now when I save, the latest vitals has been populated over here, and then also the vitals history is showing what we've done here. Now what I also want to show is sometimes the OPD nurses, maybe they use consumables on the patient and stuff like that. Maybe wound dressing, the patient has to dress they have to dress the patient's wound or something. So for that, you can come to this consumables panel, and then select this to let's say bill consumables, or actually record something like wound dressing in the system. You have to first select the store that you are taking items from to dress the wound, so, or to do something like that, or to, yes, the store you are taking the consumables from. So in this case, I'm going to pick the OPD main pharmacy store. After picking the store, you click on create consumables record. At this point, this consumables record have been created. We see items go 0, and then the date, and then the time. Now we know that some of the consumables are used in packs, so we've created this pack feature for you, where you can pick, let's say, dressing pack or whatever pack that you want to use for the consumables. So after picking the pack, you can click on apply pack here. Now the pack has been applied. We see that items now is 2, because in the pack there are only 2 items. We have gauze, and we also have examination gloves. So when you apply packs like that, not only packs, so packs aside, you can also search for specific items, right? You can also search for specific items in the case where we are failing to load, but yes, but what I want to indicate is that we can search for specific items and then add them also to the consumables that we are billing, or we are inputting into the system, or we are using for the patient, so to say. Now when that is done, you can complete an auto bill. So I'll complete an auto bill to finish the billing of the consumables, and to indicate that the patient has to pay, or right, to create the bill for that particular consumables that has been used. Then, since this is a cash patient, we also have to make payment at the cashier end. So I'll log out and log in with the cashier profile to indicate this. Now we see that the consumable, the bill has appeared on the cashier's page like we did earlier. Cashier can go on and record the payment. Now it's paid here, right? Then I'll log out and log in with the nurse account again, and then pick. Okay, so now triaging is showing ticket number 1, right? Now triaging is showing ticket number 1. So we see that we are working, or the OPD nurse, this is to indicate that the OPD nurse is currently working on patient with ticket number 1. Even without the name, it's the ticket number that the system uses to track who is being attended to and stuff like that. So then with here, when we are back and we see now triaging like this, you can click on open workspace to open the encounter workspace for this patient. At this point, we've inputted vitals, we've inputted consumables, or we've built consumables. Pretty much, if the OPD nurse feels that his or her work is done, you can now click on complete triage here. Complete triage here to complete the triage and to allow the patient to move to the next phase of the workflow. Now, in the queue here, we see that now waiting is showing no ticket form. If we check triage, we see that Oswald Odrajaman here has been triaged, right? So what happens with these status is that the next phase of the workflow, which has to do with doctor. Okay, so let me just log out and log in with the doctor's patient. Now the patient has been triaged. They can see the doctor. That's what the patient. That's what all this means. So with here, this is the doctor's dashboard. We see the doctor's username is here. We see some information on the dashboard right here. Branch department. In consult, there is no active consultation right now, but then there are some tickets right here. So what the doctor has to do is to click on start consult, and then the next patient who is in line comes here. I'll quickly finish this consult. Okay, so what the doctor has to do, let me come back to the doctor's dashboard right here. What the doctor has to do is that the system organizes this the queue for the doctor, right? So before our patient Oswald Odrajaman joined the waiting queue, there were these patients already in there. Georgina Takyiwa-Mensah and Selina Adumawachi. These tickets 2 and 3 are from previous days. That's why their numbers are bigger, but they are still ahead of Oswald, right? So when the doctor clicks on start consult, the next patient is selected, right? So the queue is already organized. That's the point I want to make. The queue is already organized. So when you click on start consult, is to say that maybe the doctor is calling next, right? So when you call next or start consult, then the one who is in line by the system is called, right? So in this case, we see that Georgina Takyiwa-Mensah is the next in line. So I'm going to quickly, because I want us to use the patient we created, I'm going to quickly do some of these things and so that we can quickly move on to our patients. So yeah, now our diagnosis, malaria. Right, and I'll finish this consultation. Get away. Right, finish consultation. We come to queue. And then start consult again. Now Selina Adumawachi is the next in line, so we can also no vitals, but we can add notes. Diagnosis malaria. Finish consultation. Now back on our dashboard now. So after doing the consultation, completing the consultation for all the other patients, now the patient we created is next in line. So what I did was to go through quickly the consultation for those patients who were ahead of the patient we created, Oswald. So now Oswald is next in line. When the doctor uses start consult, Oswald's encounter workspace is open right here. We see the name of the patient, the encounter number is on top here, and then like I said earlier, the to-do card, and then the panels are also right here. Okay, so we see that in the overview section, like I mentioned earlier, it shows what has already been done for this patient. Now we see that the vitals that the patient, the OPD nurse inputted is showing right here in the as the latest vitals. If we come to consumables also, we see that the input that the OPD nurse did is also showing right here, right? So now for the doctor to go through the consultation, you can come to the notes form. Actually here we see the latest notes, and then the notes form where the doctor inputs the notes actually, and then also the notes history, which shows all the notes recorded for that encounter. So in that case, I'm going to fail a little bit of this. Forgive me, I don't really have I'm not a doctor, so some of these data may not make sense. No cough, no dysuria, no diarrhea. Oh, that's actually history, right? Of vomiting. Right, so I've inputted some dummy data right here, and then we can save the notes. Now, the doctor has added notes or gone through the consultation details, asked patient questions. Now, the doctor may want to, as indicated in the plan, request for some lab tests. To do that, we come to the orders panel here, and then we can search for the test that the doctor wants to do, FBC want the patient to do. Now when you search, it filters the test and gives you this. You can select the test if you find it, and then create lab order. That's all that you have to do to create a lab order right here. So at this point, I'm going to log out and log in with the lab tech's profile to see how things are done from there. Right, so this is the lab text dashboard. Here it shows the navigation panel is here. The main page is also here, and also yes, the same header page. The header bar is also there. And now these are all the lab orders that are pending right now. We see that Oswald Ajimanodro is showing here. So from here, the lab tech can open the order of the patient he or she wants to work on. Now, yes, so this is the order details. We see that the requested test is FBC showing here, right? So from here, to begin, the lab person can click on start processing, and it's showing that payment required before lab processing. So because this is a cash encounter, once again, it means that all processes that require payment has to be done before that process will go through or go ahead. With that, since this is done, the record has been sent to Cashier for payment. I'll log out and log in with Cashier as we have done before to record the payment, to receive, and then me is paying cash now. Payment is done. Then I'll log out back to the lab text page, log in. I'm still on Cashier, yeah. Okay, so lab tech page, we are back on the lab tech page. If we open Oswald's lab order and start processing, now processing is started, right? So we can pick, yes, processing is started. So now the lab person can enter the results for the patient. So I'll put in some dummy information, RWBC 6.2, and then I'll put in maybe RBC as 4.75, and I'll put in platelets as 260. Yes, and I'll save the results. At this point, the result is saved, and I'll go back to the doctor's page and see how the doctor can view this from there. Sorry for switching between profiles, but I want to show how the typical flow actually sometimes look like. That's why I'm switching in between patients and stuff like that. But these roles are handled by different people, so it's not like one person will be switching as I'm doing here. This is just to show what the system is capable of. So at the doctor's page, you can resume encounter for that patient. And then when we come to the orders page here, we see that lab results ready, and you can just click on this drop down to view the result that was entered. You don't have to switch anything. This is just here for you to see. So now the doctor can see that the result has been entered, and then they can go on with their consultation, right? So it's not only I have to mention, it's not only lab orders that can be requested. We can request for procedures, we can request for imaging orders as well, right? So in this workflow, I'm sticking only to lab orders for now to keep the demo in time. So after the lab results are in, the doctor now has a fair view of what's happening, so they can go ahead and do their diagnosis, right? The diagnosis, the system ensures that you have to there's a setting that is used to control whether whether provisional diagnosis will suffice for any encounter, or we have to enforce ICD-10 rules, like ICD-10 for the encounter. Currently, the system enforces ICD-10 diagnosis for an encounter, but there is a setting that is easily adjustable if so desired, so that you can use provisional diagnosis as the diagnosis for an encounter, right? So to search for a diagnosis, you start typing, and then it will filter all the diagnoses. I want this falciparum malaria. I pick as the primary diagnosis, add them. Now after the diagnosis has been added here, I can finish the consultation. Everything is done now. I can finish the consultation right here. Now consultation is finished. Now if I pick, yes, on the queue, I pick the department OPD, and now if I check on done, we see Oswald Ajimaodru, the ticket now showing under done, because the consultation has been completed by the doctor. So this is a typical workflow involving records, cashier, triaging station, consultation, lab, right? So what I didn't also do is to show how the doctor can prescribe medications for this patient. To do that, I've opened the Encounter workspace for Mr. Oswald again. Then I come to medications panel, medication. To prescribe medication, just create prescription here. If there are notes that you want to attach, you can add the notes. It's optional. So you click on create prescription. It creates this prescription. We see that open and 0 items. To add items to the prescription, we just put artemether, lumefantrine, whatever the name is, right? And the quantity, let's say 24. Once again, I'm not a doctor, so the sick type, we have templates that the doctor can choose from. So we have one. If I start entering one, so we get this template, 1 tab TDS after meals for 5 days, right? So yes, 1 tab TDS after meals for 5 days, so it's pretty much like 15 the quantity. Let me just, yes, this is just dummy data. What I want to show is that you can choose from some instruction templates, right? Like how you want the medication to be taken by the patient, right? So you can also, there is also a custom approach here where you can input in details, select things in details right here, right? Like those, aside the template, you can also pick from these customs as to meet how you want the instructions to be done, right? So I'll pick from the template 1 tab TDS after meals for 5 days. If there are any additional notes, or less, you can input it. Don't exceed the daily max, and then you can add the item, right? So now the prescription has been created. I'll log in with the pharmacist profile and we see how it can be dispensed from there. So right now Oswald's prescription is showing on the pharmacist dashboard, and then the pharmacist can just click on it and then pick the store they are dispensing from. Now this store selection is tied to the user. So if the user is assigned to only one store, it's only one store that will show here. So the pharmacy will pick the store and start dispense. Now in the prescription, we see that the items are only artemether, lumefantrine. You can click on the item to select it and pick the batch you are dispensing from, right? So you pick this batch and then quantity. How many are you? Quantity, so 15, and then you add the dispense item. So when you add the dispense item, now it's indicated that like you've added this medication to the items you are dispensing. You can click on complete. Now the system is showing that payment is required. Again, I'll log out and log in with Cashier to record the payment. Receive and just pick, okay, you cash and receive payment, and then I'll log out and back to the pharmacist dashboard. Oswald start dispensing, right? So now the dispense lines are here. I can then click on complete, and then the dispense has been completed, right? So then if the point is that if there is payment required, especially because this encounter is a cash encounter, then the patient has to obviously make payment before the transaction will go through successfully, right? So I'll log out and log in with the doctor's account again, and we see how this it's also done, right? So from here on the doctor's dashboard, there is no one in the waiting or triaging queue or the triage queue. So there is no, these buttons have been muted. But to pick the encounter that we were working on, we can come to the encounters page here. We will see that also word is showing right here. We can also search, which is supposed to filter, but yes, you can use this functionality. We will just tweak it a little bit to make it functional. But yeah, what I want to show is that from this encounter list, we can pick the patient we want, Oswald, and then open the workspace. If we come to medications again, we see that current prescription, this has been dispensed, just as we saw from the pharmacist dashboard quite recently. So the items has been dispensed, take years, right? The details are also showing right here. So what this demo purported to achieve was to show a typical workflow that included records, cashier, triaging station, consultation, lab, pharmacy, and also account. So what we want to show now is to see how financially the information here is tracked throughout the encounter. So I'll therefore log out and log in with the accounts profile and see. Right now, invoices for today is only one. Okay, because we've obviously worked on only Oswald's, right? So this is just a snapshot, a summary of the day's financial activities in the hospital, right? Okay, so we have total bill, total paid, there is no outstanding. We can also pick from this range last 7 days to reflect the activities that has happened within the last 7 days, last 30, or maybe all time. But let's focus on today. So for today, this is what we have here. Now, if we come to invoices here, we see our patient here, Oswald Odrajoma. If we open the invoice, even though this is a cash account and they have been paying all their bills along the way, so there is no outstanding balance for this encounter yet. But what I want to show is how the system tracks all the activities that happens. We started by doing encounter 20 cedis is showing here. We build consumables which contain gauze and gloves. They are showing here with their right amount. We ordered for lab, which is showing here, and we prescribed medications, which is also showing here. So the point is that the system reliably tracks every process, and especially those that require money, so that at the end of the encounter you will not find anything missing. That is the assurance we are giving you, that you focus on capturing the data, the system will record everything for you. So if this encounter was maybe for an insurance, then we can reliably use this data as what has happened for our claims, right, for this encounter. So that is the point I'm trying to make, that the system reliably captures everything that is going on in your facility, so you don't have to be chasing shadows at the end of the day. Yes, so this is the accounts page. On the accounts page as well, we have this claims. I'll open one of the claims for us to see. In this month, we've not really done anything, but I'll open one claim that we've already built. If we open this claim, this is for the month of January, some demo I did in January. So we see this is how the claims sheet actually look like. This is for NHIS. The provider is NHIS. Total amount, the period is from 1st January to 31st January, and it was created on 23rd January, right? So this is how the claim sheet actually is. This is to show you that the system make provisions for something like this, right? So as the system tracks the transactions and processes that happens to the system, when it comes to it that you need the system to generate claim sheets for you, the system, because the data is there, HealthMate can reliably give you that information without no stress to you at all. So we also noticed that some facilities want the amount to be segregated, maybe OPD, lab, this, yes, it can be done for you. But in this form, to demonstrate, this is just to show you that the claims sheet can be generated for you with no stress to you at all. So if you want the amount to be divided as to the various components, that's just breaking it down for you. We can definitely do that for you, right? And then we also have this reconcile menu here, that we pick the branch and then all kind date from here. Now what this form does is that we notice that it is possible that as the patient is going through the hospital process, there may be things that are not billed, right? For there may be maybe transactions that are not billed, could be oversight or anything of that sort, could be any reason. Now this page allows you to see within a specific date frame all the activities that has been conducted, whether they are billed or not billed. And if they are not billed, then you can quickly remedy that situation. Currently all the items are billed, so we see build right here. But in any case that any of these items is not here, this action button, this action will show you bill, and then you can click on it easily and rectify that problem or build that encounter. So this is also very handy for account people. So yes, this is a tool that makes their work very, 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 very easy. I need to mention that also, right? Among that, there are other stuff but those are, if we want to go into those ones, we will have to do a special demo for each of the profiles. For example, account, how to create tariffs for the various providers and stuff like that. So those are also very, very, very possible. And for system admins, like I mentioned, there are settings that control something. Let me log in with HealthMate admin. This is a system admin's profile, and then come to facility config. This facility configuration, excuse me for this, there's just a dummy text. This facility config shows the behavior. It's used to control the behavior of the entire system. We are seeing that ICD policy, flexible, allow uncoded, so you can edit this at any point. So we see ICD policy, strict, ICD required, ICD grace hours, the hours, require notes before finishing, no, require final diagnosis on finishing, yes. So if you check this, it means that the doctor cannot complete the consultation without like final diagnosis, right? So what I want to show here is that this is a system-wide configurations that you can easily adjust to change the system behavior, right? So for example, payment policies, consultation. Do you want to pay before service? Yes. If pay before service, then it means that if payment is required, the patient has to make the payment before they can proceed. You can easily change this to pay later, and even if the patient is a cash patient, they can go through the process and then required to pay later. So that's just by the way. I just wanted to to mention this, to know how to show how the system behavior can be easily changed from this facility configurations form, right? So I will bring this demo to an end so that it wouldn't be too much information. Yes, I thank you very much for your time. I know that there are so many things that are not captured in here, and there are also many questions you'd want to ask. So, local coordinator with you can take the questions. You can also submit your questions. You can also reach out to us by leaving comments in this. You can leave your comments and your questions, and if there are any inquiries, you can leave your comments here as well, and we will respond to it. But most importantly, if our local coordinator is with you, you can leave with him all your questions and inquiries, and we will respond to that. Thank you very much for your time. Thank you.